Well, Obamacare is projected to cost more than $1 trillion over the next decade, and Donald Trump wants to repeal it, but Hillary Clinton wants to double down. So how would your health care change under a Trump or Clinton presidency? A question many people are asking this morning. Fox News Medical 18's Dr. Marc Siegel is here to break it all down for us. Good morning.
Great to see you, Anna.
So a headline this week is that more health insurance providers are starting to feel wary about participating in Obamacare, too.
Well, as you said, $1 trillion over the next decade. Aetna is not adding 5 more states, and they're thinking about dropping out of the 15 they already have. And United Healthcare is already out of all the exchanges, the biggest healthcare insurer in the country. So Obamacare is having trouble getting insurers to get involved with it because it's costing so much money, and they're not making money on it.
Well, and Donald Trump wants to completely repeal Obamacare. That's what his healthcare plan would look like. So let's take a look at some of the specifics on what he would like to do. He also wants to introduce competition across state lines and make all health insurance premiums tax deductible. Is this good?
Absolutely. Now, he may not be able to totally repeal Obamacare because in order to do that, he's got to get more than 60 votes in the Senate. Even if the Republicans retain the Senate and he wins, even then, the chances are that he might be able to just get a partial repeal and get rid of the mandates, which are very unpopular, and the Independent Medicare Advisory Board, unpopular. But you know what he is going to add? Not only these tax-deductible parts, but more competition. He's going to have insurers from overseas competing with drug companies from overseas competing with drug companies here.
And you think that'll drive prices down?
Absolutely. And also across state lines, insurers across state lines would drop prices. And health savings accounts are huge in his plan, where people get to transfer them, Anna. Like anyone in your family could use a health savings account that you have. Also, if you were to pass away, the next generation could use your health savings account, and it accumulates year to year. That would make us more like other countries where people know what they're buying, where you actually see the health care you're getting. And guess what that'll do? Drive prices down. You wouldn't believe how high costs are, because in one hospital, an echocardiogram is $800. In another hospital, it's $200. If you knew the prices because you were paying for it yourself, it would end up being less.
Yeah, and then you end up being more conscious about how you're spending your money, too, a lot of times with those HSAs.
Absolutely.
All right, let's take a look at ClintonCare
So more
now.
choice, more competition, lower prices.
There you go. All right, he said it first right here. Now for ClintonCare, she wants to expand Obamacare to cover more Americans and provide $5,000 per family for health costs and expand Medicaid to all 50 states. Well, you say it sounds good, but who's going to pay for it?
Look, viewers out there are going to like the idea of deductibles being less, co-pays being less, capping what you have to pay to your drug companies if you want to buy prescription drugs. Everyone says that sounds good. 3 sick visits a year, fully paid for under Hillary's version of Obamacare. First of all, if the Republicans retain the House, which is almost definite, none of this is going to pass. None of it. But if it did, okay, it sounds good. Imagine what it costs. You know, it's already $1 trillion over a decade. These are huge additional costs, an expanded entitlement. It would break the bank on Obamacare. So, again, if you have a lower deductible, you might be more inclined to use it if you can find a doctor that will take care of you, if you can actually get the procedure you want approved, because this is a highly regulated, government-supervised, extremely expensive entitlement. These bells and whistles are not practical.
Well, for both plans, it's a lot for folks to chew on. So you're going to be going to our green room right now. Friends at home, if you want to ask the doctor some questions, email us, friends@foxnews.com, or hit us up on social media. Thanks for your time today.
Very, very important differences. One, Trump increased competition and decreased cost. The other one, Hillary, more entitlements.
Okay, that's the bare bones basics. Thanks.